In the past few weeks, the infection and hospitalization rates in Germany have been rising almost consistently to new record highs. With the new variant Omicron emerging as a major cause for concern, yesterday the designate Chancellor Olaf Scholz and outgoing Chancellor Angela Merkel attended a crisis meeting, along with the premiers of Germany's 16 federal states. They agreed on stricter measures to curb the fourth wave of the pandemic, which has been pushing the hospitals to their limits. Here's a summary of what they have discussed and agreed upon. Number one, mandatory vaccination. The federal government is introducing a facility-related vaccination requirement for employees, for example, in senior care facilities and hospitals. Despite initial reservations, Germany could make coronavirus vaccines mandatory for all adults with no medical contraindications as early as February 2022. However, the final decision on the general vaccine mandate is to be made by the Bundestag. Number two, vaccination at the dentists and in pharmacies. In order to strengthen the vaccination campaign in Germany, 30 million more vaccines are to be administered before Christmas. To achieve this ambitious objective, soon pharmacists, dentists, and nursing staff will also be authorized to administer COVID jabs. Number three, 2G rule everywhere. It was agreed that only those who have been vaccinated or have recently recovered are allowed access to cultural and leisure venues, such as cinema, theater, restaurants, and the like. The same applies to shopping, except for essential items, that is, in supermarkets and drugstores. This rule has already been implemented in several federal states with higher infection and hospitalization rates, but now it will apply all over Germany and regardless of the infection rates. Number four, vaccination to be officially recognized, valid for a limited time. Since it was established that the efficacy of COVID vaccines wane over time, the federal and state governments have agreed that fully vaccinated status can only be retained if the individual gets a booster jab. Currently, everyone is asked to get their booster jabs 5 to 6 months after their second vaccination. And before the end of this year, we should know exactly how long our vaccination status is going to be valid. Number five, strict nationwide contact restrictions for unvaccinated people. According to the new restrictions, those who are not vaccinated are effectively barred from public activities. Also, private get-togethers for them are going to be limited to their own household and no more than 2 people from another one. Number six, mask requirement in schools. Despite the high infection rates among children, school closing is to be seen as the very last resort, but mask requirement will be reintroduced nationwide for children of all grades. The federal and state governments have also agreed on revising the Infection Protection Act to provide state governments with additional measures such as temporary closing of restaurants, bans on selling or consumption of alcohol outside, and restriction on gathering and hotel accommodation if they are dealing with higher numbers of infection and hospitalization locally. This was a summary of the new restrictions you need to consider in the coming weeks and possibly months. Take care and see you next time.